The electrocardiogram, EKG, records the electrical activity of the heart, providing a record of cardiac electrical activity, as well as valuable information about the heart's function and structure. The EKG records the electrical activity of contraction of the heart muscle, myocardium. The interiors of heart muscle cells, myocytes, are negative, polarized, at rest, but when depolarized, their interiors become positive and the myocytes contract. As a wave of depolarization progresses through the heart, it causes contraction of the myocardium. The depolarization wave, cell interiors become positive, and a phase of repolarization, cell interiors return to negative, that follows, are recorded on the EKG as shown. The depolarization wave, cell interiors become positive, and a phase of repolarization, cell interiors return to negative, that follows are recorded on the EKG as shown. Sensors called electrodes are put on the skin to detect the heart's electrical activity. The EKG machine records this activity on moving paper as an electrocardiogram. As the positive wave of depolarization within the myocytes flows toward a positive electrode, there is a positive upward deflection recorded on EKG. The heart's dominant pacemaker, the SA node, initiates a wave of depolarization that spreads outward, stimulating the atria to contract as the circular wave advances. Each depolarization wave emitted by the SA node spreads through both atria, producing a P wave on the EKG. Thus, the P wave represents the electrical activity, depolarization, of both atria, and it also represents the simultaneous contraction of the atria. The atrioventricular, AV, valves prevent ventricle to atrium blood backflow, and they electrically insulate the ventricles from the atria. Except for the AV node, the only conducting path between the atria and the ventricles. When the wave of atrial depolarization enters the AV node, depolarization slows, producing a brief pause, thus allowing time for the blood in the atria to enter the ventricles. Slow conduction through the AV node is carried by calcium, Ca++ ions. Depolarization conducts slowly through the AV node, but upon reaching the ventricular conduction system, depolarization rapidly shoots through the bundle of His and the left and right bundle branches in their subdivisions. The terminal filaments of the Purkinje fibers rapidly distribute depolarization to the ventricular myocytes. Depolarization of the entire ventricular myocardium produces QRS complex on EKG. The Q wave is the first downward wave of the QRS complex, and it is followed by an upward R wave. However, the Q wave is often absent on EKG. The first upward wave of the QRS complex is the R wave. Following the QRS complex, there is a segment of horizontal baseline known as the ST segment, and then a broad T wave appears. The T wave represents the final, rapid phase of ventricular repolarization, in which ventricular repolarization occurs quickly and effectively.